Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. President Muhammadu Buhari and Vice President Yemi Osinbajo to take Oxford AstraZeneca jabs publicly on Saturday. NAFDAC Director General Professor Mojisola Adeyeye assures Nigerians of thorough pharmacovigilance and proper documentation. And South African scientists make discovery on COVID variant. While daily infections in Nigeria seem to be declining, the fatality toll appears to be on the rise within the past few days. According to the Nigeria Center for Disease Control (NCDC), the number of coronavirus deaths in the country now stands at 1,939, having doubled in the last 24 hours from Tuesday's daily tally of 8 to 16 deaths and a total of 32 in a span of 3 days. But the good news, however, is that more recoveries have been recorded in the country, as data published by the NCDC earlier today shows a daily tally of 1,280 recoveries from COVID-19 within 24 hours, representing the highest single-day count in 2 weeks. Well, this brings the number of discharged cases to 135,831. Out of the cases discharged, 229 are community recoveries recorded in Lagos, 144 in Imo State, and 45 in Akwa Ibom. The center also confirmed 464 new infections across 21 states and the FCT, a slight drop from the previous day of 479 cases daily tally. Now, the new cases are reported in 21 states and the FCT, Lagos topping the list with 131 cases, followed by Kaduna 69, Akwa Ibom 33, Imo 31, Katsina 30, Kano 26, Ondo 23, and you can see the list of the other states that recorded numbers as well. Now, while 19,212 cases are still active in the country, the NCDC DG in a tweet today says the agency's biggest priority now is to control the acute phase of the coronavirus pandemic using all available tools, including vaccines and public health measures. Now, around the world, more than 115 million cases have been reported, with the U.S. topping the list with over 28 million confirmed cases. Nigeria's President Muhammadu Buhari and Vice President Professor Yemi Osinbajo and the Secretary to the Government of the Federation, Mr. Boss Mustafa, will be vaccinated publicly this Saturday. The Executive Director of the National Primary Healthcare Development Agency disclosed this at the presidential briefing on the health sector, saying that it is aimed at increasing confidence in the vaccines and overcoming vaccine hesitancy. According to him, the exact time will be communicated much later, with members of the Federal Executive Council to be vaccinated Monday next week. Here's more. Our correspondent Gloria Muzuke reports.
Discussions about the COVID-19 vaccination exercise is central at the continuation of the presidential briefings in the State House. The Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, announced that as part of strategies to curb vaccine hesitancy, the President and Vice President will publicly receive the first jabs.
Frontline health workers will be the first people to get the vaccine. After that, the plan is to vaccinate Mr. President, Mr. Vice President, and strategic leaders on Saturday. Again, we're hopeful that when Nigerians see leaders like Mr. President and the Vice President take this vaccine, it will increase their confidence around the safety of the vaccines.
The National Agency for Food, Drugs and Administration Control, NAFDAC, also warns that falsified COVID-19 vaccines are already in the global market, hence the introduction of the track and trace technology.
Our own staff are getting ready. We are training other staff in terms of pharmacovigilance. Because once the individual gets the vaccine, our work starts in terms of pharmacovigilance, asking what is going on, things like that, and making sure that it is recorded. Because we join the the global world by also contributing our own data, that this is what we have in Africa or in Nigeria.
In spite of the vaccine arrival, the Presidential Task Force on COVID-19 illuminates the need for increased investment in the health sector.
We have at least 2 vaccine candidates in Nigeria, but they need a lot of resources to go through the clinical trial phases. The trials, phase 1, phase 2, phase 3. So we're trying to look for the resources to support them in doing that. And until that is done, which will take at least a year, we are not yet directly going to be in that game. We have a vaccine production company called BioVaccines Nigeria Limited, owned 49% by the federal government, which is looking to partner with other vaccine producers and perhaps produce under license here if the technology transfer agreement or discussions go through.
We have to continue our surveillance. We have to continue our testing. We have to continue protecting our healthcare workers with the personal protective equipment that we're doing. We have to sustain the critical investments that we've put into our health security infrastructure for the first time in decades. We cannot let this go because we have to continue this work.
From surveys conducted by the PTF, 50% of Nigerians have indicated willingness to be vaccinated, while only 25% are still hesitant. From the Presidential Villa, Gloria Umezuke, Channels Television News.
Outside Nigeria, a group of South African scientists have discovered that people infected with the 501Y.V2 variant of COVID-19 generate immune responses that offers them protection against other coronavirus variants. The genomics team were joined by the Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande, and Health Minister Dr. Zweli Makize, in giving an update on local research conducted on the second variant of the coronavirus in a web briefing. The team, which detected the 501Y.V2 variant last year, found the variant is more transmissible but does not cause more severe forms of COVID-19.
The research done by the KwaZulu-Natal Research Innovation and Sequencing Platform, CRISP, working together with the National Health Laboratory Services, African Health Research Institute, and CAPRISA, as well as the National Institute for Communicable Diseases, have come out with the findings which have demonstrated that those who were infected in the second wave, which was now dominated by what we have been referring to as the new variant, 501Y.V2, have protection from current and previous circulating variants. The 501Y.V2 variant is able to generate immune responses, we have now found out through our scientists, that neutralize itself and other SARS-CoV-2 lineages.
And this actually opens up a basis for a conversation which we are now have already started having with the manufacturers of the various vaccines, because in those engagements we are now actually saying the vaccines need to actually target the bigger problem, which is the 501V2. When we noticed that AstraZeneca was able to neutralize the variant which was in the UK and in Brazil, but not the one in South Africa. And therefore, it means therefore more work needs to be done in this regard. And everyone, all eyes on South Africa as to the level of success recorded in this regard.
It's rather interesting, the new developments we're learning from the coronavirus. But joining us to talk some more is Professor Ikemefuna Uzochukwu. He's a pharmacist, professor of medicinal chemistry at the Nnamdi Azikiwe University with special interest in computer-aided drug design, especially for emerging infectious diseases. Thank you for joining us on the program. I'd like to begin by asking what your reaction is to the open or public vaccination of the Commander-in-Chief and other members of his cabinet this weekend.
Thank you and good evening. the public vaccination of the president and the vice president is a fantastic idea, very fantastic. Reason being that already Nigerians are not sure they can trust their government. Now that we have received vaccines into Nigeria, it is important that the key public officials demonstrate that this vaccine is efficacious and safe by taking them publicly before our people. This will boost confidence and immediately reduce vaccine hesitancy. That is well known and well established. So we are going in the right direction. The president of the country, the vice president of the country receiving the vaccine this weekend is a welcome development, and it is going to change the game in Nigeria. Thank you.
Professor Uzochukwu, I mean, do you expect that Nigeria is building capacity? And this is in terms of conducting research, investigation into the vaccines for COVID-19. I mean, for example, how much would it have helped if the country had joined vaccine trials like South Africa did earlier?
Whether Nigeria is building capacity for vaccine development, the answer is yes and no. Yes, because something is being done right now to maybe start vaccine research and some production. But no, because we have not invested before now. You know, these countries that have that first to market capacity, they have been investing all these years. So Nigeria currently, the federal government, the state government, they are not investing enough in research. And so we are not really ready. Even the Minister of Health said it just some minutes ago on your channel TV. We are not ready to join the race when it comes to research. The things that countries like South Africa are doing, we cannot do because we don't have the capacity as at this moment. But let us believe that they will find the money or the fund, as they say. However, at the local level, at university level, at research institutes level, a lot is happening. The willingness is there, the funding are meager. I will give a practical example. My university, Nnamdi Azikiwe University, you may wish to know, my vice chancellor is a professor of pharmaceutical microbiology and biotechnology. So the issue of vaccine is his area. He did his postdoc developing viral vectors for vaccine production. But when you return to Nigeria from top-notch universities, you find out that you can do virtually nothing because there is no NEPA, there are no laboratories to help you do what you have learned to do. Right now, my university is building 3 molecular laboratories that are of international class. One at Nnewi campus, one at Agolo campus, where we have the School of Pharmacy, and one at Oka campus. So universities are using the little meager resources they have, either from TED Fund or from IGR, or even from private-public partnership, to put some things on ground so that we can actually begin to even do small research, such as pharmacovigilance research, as soon as these vaccines are being administered in Nigeria. So that's why I said yes and no. We are not doing enough at the federal level. We're not doing enough at the local level, at the state level, but the universities are trying their best to see if we can catch up our adventure. Thank you.
Professor, I must quickly ask you this. We just have a few seconds before we let you go, and that is regarding the safety and efficacy to combating COVID-19. What's your take on the vaccine that we have received? The argument from some experts is that we got the type that is yet to conclude its phase 3 trials from India. I mean, is there a risk that we do not know all there is to know about the Covishield?
The information about safety and efficacy of these vaccines are in public domain. Any person that tells you that they have not concluded research and therefore this vaccine cannot be used in Nigeria is not telling you all the truth. There is a document released yesterday. What if you understand how research are done? It is never ending. From your result that you have done, they used about 25,800 people in the clinical trial. You can generate your preliminary findings. If nobody died out of 25,800, you have every reason to immediately approve that vaccine for use. NAFDAC is supposed to study the vaccine documentations and then give approval if they find it so good and safe. And that is what they have promised to do. So I have no doubt whatsoever that the vaccine is safe, because I've seen the documentation from India about this vaccine. So any person who is saying otherwise is either towing the line of conspiracy theories or has some other agenda. The issues are clear and the documents are in public domain. Anybody can read them up.
Thank you, Professor. Professor Ekemefuna Uzochukwu, a pharmacist, Professor of Medicinal Chemistry at the Nnamdi Azikiwe University. Thank you for joining us on the program.
Thank you.
Still to come, ahead of vaccine inoculation, states across the country are training and want to sensitize on the COVID-19 vaccination. We have that update when we return. Now, states across the country are preparing to receive the coronavirus vaccines. In Benue State, the government has expressed readiness to receive and safely store its share of the over 4,000 COVAX COVID-19 vaccines. According to the Commissioner for Health and Human Services, people have not indicated interest to be vaccinated. He said the training will commence for 46 volunteers starting from tomorrow on vaccine handling procedure. The Commissioner also says those with underlying health issues and those above the ages of 60 will be considered first in the administration. Meanwhile, for his Oyo State counterpart, the state is providing a different plan in the vaccination rollout.
We are expected to carry on a training on how vaccines will be distributed across the nation. So for Benue, we are going to start this training tomorrow. And we are expected to also isolate a cold chain room at the central medical store, which I'm going to inspect that today. We have a cold room that has a capacity. In fact, that is keeping vaccines. Has stored vaccines of over 2 billion, worth of over 2 billion naira. And so I've asked the ES Primary Health Care Board to go there and ensure that we'll have a space kept specifically for COVAX, so that then the other issue is acceptability. That is why we're going to have a training.
Oyo State is providing a different order. We are only examining which is best and which can be maintained or sustained at a very good temperature before all the vaccination program could start off. Meanwhile, people are being trained on these vaccination processes. The state has its own program or storage for immunization processing, and the same are the temperatures that might be required, because the ones the state is most likely to purchase will be those that are temperature friendly.
Dr. Oluwaseun Akinyemi is a public health physician with University College Hospital Ibadan. We'd like to thank you for joining us on the program. If you listen to the Oyo State Commissioner for Health, he hinted at another order of vaccines rollout, different from the one announced by the federal government of frontline workers first. Are you aware of this, and what's your impression?
Oh, thank you very much, Millicent, for having me. Yes, I'm not very aware about the plans of the state to get other vaccines. But I think that, and this is my opinion, that it's a welcome development, states that can procure vaccines, because what we have at the federal level, about 4 million doses, is grossly inadequate to go around the country. But states who can procure their own vaccines, I think it's a welcome development. But I think that the rollout, as you said, will still be, to the best of my understanding, similar to what the federal government is planning. The frontline health workers first, followed by the elderly and those with comorbidities.
How prepared would you say the state is to receiving the vaccines? I mean, some states are recording skepticism, vaccine hesitancy. What's your take on the feeling, the atmosphere in Oyo?
Okay, in terms of infrastructure, I think the state is ready. The infrastructure we have
in Oyo State in Ibadan, we have the Zona Cold Store, which has been used to store vaccines since the days of polio immunization. But in terms of hesitancy, we still have a lot to do in terms of improving awareness. In some cases, you'll be surprised that some people still don't believe there is COVID infection at all, talk less of getting the vaccines. So I believe the state still has a lot to do in terms of improving awareness and reducing vaccine hesitancy. There's still a lot to do. But I believe that once the rollout starts, and the example from the state governor getting vaccine, the principal officers getting vaccinated publicly, I think it will help go a long way to improve confidence and then reduce vaccine hesitancy.
Finally, the coronavirus cases in the state, what do you make of the numbers? Oyo is about the second highest in the southwest. Would you say that the worst is over?
Well, I would have loved to say the worst is over from the point of view of faith and hope, but in reality, I think we still have a lot to do. The figures still show that, like I said earlier, the use of face masks is still very poor, especially in public places in Oyo State, especially in Ibadan. You go to the market, you go to stores, people are moving freely. The face mask use is not as high as it used to be. So we need to still ensure that all these measures are enforced if need be, so that we don't lay down our guards. And I think, of course, the numbers we see, it's a multifactorial thing, nearness to Lagos and some other thing, but
we'd like to thank you, Dr. Oluwaseun
we still need to ensure that our measures are used. Yeah.
Thank you so much for joining us on the program. Public Health Physician, University College Hospital. Thank you.
Thank you.
The World Health Organization says a promising 6-week decline in COVID cases in Europe has been disrupted by a rise in infections. The health agency's regional director for Europe says there's been a resurgence in Central and Eastern Europe, and new cases are also on the rise in several Western European countries where rates were already high. He has called on European countries to expand supply and access to vaccines.
Here's a look at the COVID-19 situation around the world. Brazil has announced new restrictions, including a nighttime curfew from 11 p.m. to 5 a.m. in Rio de Janeiro, the country's biggest city. Restaurants have been ordered to close at 5 p.m., and businesses such as clubs must shut entirely. The new restrictions will last until March 11. A partial lockdown is also in place in Sao Paulo. Egypt has expanded its coronavirus vaccination rollout to include the elderly and people with chronic diseases after several weeks of vaccinating medical staff. Nearly 153,000 people have applied for vaccination since Sunday, February 28th, when the North African country opened online registration. The country has prepared 40 vaccination centers and plans to increase the number after the arrival of more vaccine batches.
Remember, you have to continue to take responsibility. Visit our website for more updates, a better understanding of the pandemic. You can find other stories there as well. It's channelstv.com. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.